Good morning, and thank you for joining us on this Medicare update at CPS Insurance. I'm Matt Anderson, Director of Marketing and Medicare with CPS, and with me today is Dan Grisette, CPS's lead Medicare advisor. Essentially, over the next 15 minutes, we wanted to give you a brief on the ways that CPS can help you and your clients with Medicare planning, especially those that are turning age 65 and becoming Medicare eligible. So over today's presentation, we're going to cover the following. First, the two different Medicare programs that CPS offers. Next, why Medicare conversation is such a critical conversation to have, how our planning process works specifically, and then a couple of different ways that you can get started if you wanted to take advantage of this program. So as I mentioned, CPS really offers two different models that we can assist with Medicare planning. For those advisors that are currently certified to sell Medicare, we can help facilitate those sales. And we can come up with marketing dollars to help you market to your current clients or maybe new clients. Today's conversation, though, is primarily going to focus on advisors that aren't certified to sell Medicare. Dan, tell us a little bit about how CPS agents and advisors who aren't certified to sell Medicare can partner with CPS and deliver value to their clients and protect their book of business.
Thanks, Matt. We know there are many reasons for not getting certified for Medicare sales. Agents and advisors have told us they're simply too busy doing everything else and don't have a spare 100 hours every year to go through Medicare testing and certification. And so they pay attention to other client services. For this busy advisor, CPS has the perfect solution: turnkey Medicare advising for Medicare eligible clients.
Turnkey. What do you really mean when you say turnkey?
We make it really easy for a busy CPS advisor to better serve Medicare eligible clients. All the advisor needs to do is make an introduction and turn the Medicare work over to us. It's as easy as sending an email to the client recommending timely advising and making a follow-up phone call.
And you mentioned timely advising. For those of us not in the know, what do you mean by timely advising?
When it comes to Medicare advising, Matt, timing is very important. Medicare enrollment at age 65 is mandatory. It's not optional. And if a client misses an enrollment deadline, it can result in a late enrollment penalty that lasts for the client's lifetime. Almost without exception, when a client turns 65 and becomes Medicare eligible, the rush of TV advertising, phone calls, and direct mail marketing is overwhelming and confusing. And in the middle of this, rival agents are in the mix working to capture the advisor's client for Medicare sales.
And, what can we really offer when an advisor's client is kind of becoming overwhelmed and confused by all of these Medicare marketing by the rival agents? What can we do about that?
Matt, we meet that moment with answers. Our turnkey advising fosters a supportive relationship by answering all the questions a client has. We find that answering these questions creates a more informed client who can confidently make an eventual decision about a coverage solution. This advising relationship also prevents a rival agent from capturing the advisor's client.
Got it. For an advisor who isn't certified to sell Medicare sales, but wants to make sure that he keeps control of the client during this critical time, remind us, what does that advisor need to do?
So to leverage our turnkey advising, Matt, a CPS advisor only needs to do two things. Very simple. Introduce us to the client with a friendly email, and then make a follow-up phone call. From that point on, we go to work answering questions, planning alternative solutions, and recommending coverages when needed. It's pretty simple.
Now, I understand that all of our advisors obviously want to do what's best for the client, but at the end of the day, they're really in the business of making a living for themselves as well. What are some of the benefits to our advisors when they recommend the turnkey advising that CPS offers?
Matt, there are at least three upsides for recommending our advising service. First, the advisor earns a referral fee when the client chooses medical coverage solutions. Two, by having a conversation to help a client, the advisor builds new goodwill with that client. And three, a new conversation can open up opportunities for retirement-related sales for products like annuities and long-term care. These are the ways that making the advising connection can be a win for the client and also a win for that advisor.
Got it. And again, for an advisor that isn't certified for Medicare advising, can you describe a little bit more about what goes into that advising process?
Matt, our advising work occurs in four phases. The first is Medicare enrollment in parts A and B. Second, organizing data about the client's key retirement expectations and preferences. Third, researching available Medicare coverage solutions. And finally, providing action alternatives to the client. Overall, this advising process I've just described usually is completed in less than a month.
Got it. That's interesting. You say usually completed in less than a month. I have heard situations where you talk about longer than a month. How could it be longer than a month? Why longer than a month?
Well, when a client needs help with getting enrolled in basic original Medicare, our key advising process can be delayed for several weeks. For clients who are not yet approved for Parts A and B of basic Medicare, we help them get their application submitted through Social Security for that approval. That can be done online or sometimes by mail when other documents are needed in addition to that application. Once the submittal is done, however, an approval letter from Social Security usually arrives within 3 weeks. By this time, our advising process has reached what I call the phase 4, where the client has chosen a preferred coverage solution that needs then to be implemented.
Got it. Can you give us all a little bit more detail about Medicare coverage alternatives that the client may choose?
So there are two alternatives, Matt, in terms of choosing a client choosing Medicare coverage. The client has the choice of a Medigap plan or an Advantage plan. It's one or the other, but not both. A Medigap plan is sometimes called a supplement plan. Though some think of it as a PPO plan, it goes way beyond a PPO. A Medigap plan allows the client to get medical care from any provider in the US who accepts Medicare. And that's about 99% of providers. As it sounds, Matt, a Medigap plan fills in for the gaps in Medicare. It can pay the deductibles, the co-insurance, and other out-of-pocket risks that can lead to unlimited out-of-pocket costs when only basic Medicare is in place. A Medigap plan has a monthly premium that increases as a client ages and is usually combined with a drug plan that changes annually.
And if you put it simply, really, what's the Advantage plan? How is the Advantage plan different than the Medigap plan?
It's a different side of the street, if we could say that Medicare has two sides to the street. An Advantage plan is a version of managed care like an HMO, where a client chooses to get medical services from a local medical group that's connected with an affiliated hospital. By contrast, Medigap services don't have a restriction to a particular medical group. In an Advantage plan, all of the benefits of A and B of Medicare are included, plus there are a number of other benefits built in, such as gym membership, over-the-counter allowances, and drug, dental, vision, and hearing benefits. One of the reasons Advantage coverage is gaining in popularity is because many of these benefit-rich Advantage plans come with no or very low monthly premiums.
Got it. Now, as I've personally listened to you talk about Medicare advising, some of the times I hear you talk about the keys to success, and you put a lot of importance on good timing, careful listening, and expert research. Before we finish up today, can you remind us the importance of each of these components in your advising process?
Matt, first, timing is important, as we've mentioned earlier, because decisions need to be made when the client is turning 65. The client will be asking, and it always comes up, when should I enroll in Medicare? If, for example, a client is continuing to work past 65 and has employer-sponsored medical coverages, Medicare enrollment can be deferred until leaving that employer plan. However, if that plan is a small group with fewer than 20 employees, enrollment cannot be deferred, and the client must enroll when turning 65. We also see situations where the client continues working and can defer enrollment, but there is a compelling reason to shift to Medicare before retiring. In that situation, a comparison that we do of benefits and costs between the employer plan and Medigap or Advantage coverage may bring an advantage in choosing Medicare for that client and leaving the employer's medical coverage earlier. Second, listening. Listening carefully to a client helps us clearly understand the priorities, plans, and resources of the client. Will retirement mean traveling and spending time in other states visiting family and grandchildren? Will retirement mean lower monthly income and need to downsize living expenses? Or will retirement mean new health challenges that call for special medical treatment and attention? This helps us cover priorities and what we call life facts and do the kind of personalized planning that is far superior to check the box advising. Third and finally, Matt, good Medicare advising depends on skilled research. All of the topics we've covered become individual pieces in the client's Medicare puzzle. The art of our advising is fitting these pieces together so that they form a personalized Medicare solution for the client. In the case of Medigap research, we do extensive premium and product performance history research, as well as market comparisons among the plans available to the client. Our Advantage Plan research requires careful tracking of the medical group affiliations the client's preferred physician may have. This thorough research ensures that the plan we recommend allows the client to continue with the preferred primary care physician and have access to the preferred acute care hospital as well.
Got it. Well, Dan, first, thank you. Thank you for describing how an advisor can easily refer over a Medicare eligible client for turnkey personalized advising. Just to recap what we've covered today, first, if you're not certified for Medicare, we can be your advising partner and provide timely, valuable service to your clients. As partners, we can prevent another agent from rating your book of business, which is a huge advantage to you. A new conversation with the Medicare eligible client always has the opportunities to open up other opportunities like retirement related sales. And finally, you can certainly earn a referral fee as you introduce a client for Medicare advising and that client chooses to move forward with a Medigap or Medicare Advantage plan. For those of you that want to add the Medicare advising to your menu of services, please feel free to click the link below and we'll provide you with a startup checklist and a sample introductory document to introduce you to the services to your clients that are turning age 65. And for those of you that want a choice in the alternate coverage options, I strongly suggest that you use Dan Grisette for that service. Remember this, you can deliver peace of mind and keep your clients in your book of business when you take hold of the Medicare planning process. If you have any questions that you'd like to ask offline, please feel free to reach out to Dan Grisette directly. His number and email are below. Thank you all for attending today.